Get rid of that frown that's been dragging you down and get up in the air. Just pretend that you can fly. You'll never know if you can till you try.
Hi, and welcome to Cannabis Helps Dementia. I'm Chella.
I'm Dave, and right up front we'd like to say that we're not doctors or medical professionals, and nothing you hear in this podcast should be considered medical advice.
Right.
We're not experts, but throughout this podcast series, you'll hear from doctors, nurses, research scientists, administrators, other caregivers, and people living with dementia about how cannabis helps.
Like it did for our family.
That's right.
After my mom was diagnosed with dementia, we were thrust into family caregiving and became fierce advocates for people living with dementia,
including their access to cannabis medicine. Fierce advocate and Harvard Medical School professor Dr. Peter Grinspoon is a primary care physician at Massachusetts General Hospital and has been involved in cannabis research his entire life.
You might know of his father, Dr. Lester Grinspoon, who was also a Harvard Medical School physician, an Associate Professor of Psychiatry who in 1971 wrote the revolutionary book that brought science to the modern cannabis legalization movement, Marijuana Reconsidered.
Dr. Peter Grinspoon is known as an authority on virtually all aspects of cannabis, including adult and medical uses, as well as political issues and social history, as many of the thought leaders of the cannabis movement hung out in his parents' living room, and his older brother found some relief during his losing battle with childhood leukemia.
He served as an expert witness, as a consultant, and a medical and scientific advisor. He also knows firsthand how powerful cannabis can be in healing from opioid addiction, which he wrote about in his engaging memoir, Free Refills, A Doctor Confronts His Addiction. Oh, well, Dr. Grinspoon, thank you so much for joining us today.
Thanks for having me today.
Awesome. So, Dr. Grinspoon, you are a primary care physician at a major hospital and also do special cannabis consultations and coaching. How often do you see people living with dementia?
Well, I see people living with dementia all the time, both at work as a primary care doctor. You know, the population's aging, and at home, my mom lives in a retirement community right a couple blocks away from me, and I visit her. And obviously, you know, people in their 80s and 90s, and even a couple people in their hundreds. There are plenty of people there who are suffering from, you know, the whole range of like mild cognitive impairment to full-blown dementia. So, you know, dementia isn't just like one thing. It's a whole spectrum of things.
Right, absolutely. So do you advise those seeking relief from anxiety or behavioral symptoms in dementia with medical cannabis?
Well, it's more like cannabis should be one of the tools that we have at our disposal.
Yes.
I wouldn't say that I necessarily say that cannabis is like necessarily the first thing that you should try, but cannabis should be one of several options depending on the patient's circumstances, their preferences, and their symptoms. You know, the funny thing is, as a primary care doctor, I utilize medical cannabis for my patients for pain, for insomnia, colitis, anxiety, a whole bunch of things. And it actually makes my life a lot easier. And if the funny thing is, you know, doctors have been like slow adapters of or adopters of medical cannabis. And, you know, they're slowly coming around. They're so much slower than patients. The patients have really nailed this, you know, with 94% of patients being in favor of legal access to medical cannabis. And the doctors have just, and there are a million reasons for this that we could discuss. But it's sort of a complex issue that I'm really interested in. But doctors have been so much slower. But the irony is that it makes your life so much easier as a doctor if you have access to this versatile, relatively non-toxic medicine, plant-based natural medicine that in many cases, like for example, for chronic pain, is less toxic than the alternatives. So I would say with people with dementia, it's not really different than my other primary care patients. I would say, is cannabis less toxic than the alternatives? Say for insomnia, it's very hard to treat elderly people with dementia with insomnia. What are you going to use? A tricyclic, Ambien, a benzodiazepine? So is cannabis less toxic than the alternatives? And if so, then I would absolutely recommend it.
Excellent. Yeah, my mom was given a lot of antipsychotics to help with her aggression and anxiety. And I'm sure cannabis would have been a much less toxic alternative than those black box drugs.
right? It probably would have been a significantly less, and it's insane that nobody was able to try it or nobody thought to try it. Again, no medication works for everybody, and not everybody can tolerate any particular medication. So, cannabis isn't like a cure-all for everybody, but
Right,
it's,
right.
in general, you can make the statement that cannabis used responsibly is less toxic than, antipsychotic. And I'd much rather try that before an antipsychotic on someone in that scenario. Absolutely.
Yeah, I was going to
Right.
say, is this something that you would try as a frontline medicine and then move on to the antipsychotics as opposed to vice versa?
Well, by the time people have dementia, they've usually tried things. They've had pain before, they've had insomnia before. It's rare that you're trying things as a frontline medication. And it also depends a little bit on the scenario, like how, what they're going through. But certainly, if someone's having insomnia, try cannabis as a frontline medication for sleep. A couple drops of high CBD, assuming there are no medication interactions, a low THC tincture to see if it would help them go to sleep. I mean, I think that's arguably a lot safer than any kind of hypnotic you might use. But again, cannabis does have psychoactive effects, and you have to be careful. But you'd have to be careful with anything else you'd be using. So
Hmm.
that's a long answer to yes. I might try that as a frontline treatment, depending on the circumstances.
Sure, sure. So let's talk a little bit about harm reduction, how cannabis can treat pain or replace opioids and reduce polypharmacy. Do you have a favorite study that you might want to reference?
Well, there was a really good study out of Israel, I believe in 2018, where they studied 2,700 patients. They're trying to demonstrate whether cannabis is safe in the elderly. The
Hmm.
average age was like, I believe, in the late 60s. It might have been in the 70s. So it wasn't like super elderly.
Hmm.
These days, it might have been, like 50 years ago.
Right.
But and they studied again like several thousand patients, and they were patients suffering with cancer and with chronic pain. And first of all, there were 3 points. One is that it was very effective for pain. The average pain scale went down from like an 8 to a 4, which is pretty effective. I mean,
Mm-hmm.
treating chronic pain, that is pretty remarkable. Second of all, the use of benzodiazepines went down, and 18.1% of people either cut down and eliminated their use of opiates.
Mm-hmm.
And the third thing, which is really what they were looking at, is how tolerable the medication was. And there were no serious side effects. 9% of people had dizziness, and 7% of people had dry mouth, which are, dizziness can be a side effect in the elderly. You have to be careful. You don't want to fall. A lot of these people can be shaky, anyways. But compared to a lot of the other medications you've already mentioned, that's pretty minor side effect, all things considered. So I
Mm-hmm.
thought that was a really interesting study to show
Yeah.
safety and effectiveness in the elderly. One other study that I think is really interesting. I love the work of Stacy Gruber
Mm-hmm.
at McLean Hospital, and she did a study in 2018 called "The Grass Might Be Greener," and she studied medical cannabis patients, not necessarily elderly patients with dementia, and
Mm-hmm.
she found that the cognitive, she studied cannabis for decades and
Mm-hmm.
studied like decrements in cognitive function with recreational or adult use cannabis. Now, I would argue that it's not necessarily a decrement in cognitive function, but a change, because there's no way to measure like the increase in like creativity and connectivity with other people and spirituality and appreciation of music and art and all that stuff. But
Yeah.
at least in the left brain test that she's using, um, people didn't perform as well. And we know that it does affect your short-term memory. There's no question temporarily that comes back if you stop using it. But
Mm-hmm.
the medical cannabis users had improved cognitive function after 3 months. And not
Mm-hmm.
only that, they had markedly lowered use of benzodiazepines and opiates. So there are many, many studies that show that when cannabis is legalized medically or for adult use, um, prescriptions both for opiates and for benzos and for other medications that are involved in opiate overdoses, like the gabapentinoids, all go down, and alcohol use goes down as well.
Yeah.
The studies are, vary. They're not all like smoking guns, but generally you get a very good picture that people do substitute. I mean, I sort of like have this theory that people mainly, or a good amount of alcohol use is because cannabis has been illegal. I mean, cannabis is
Mm-hmm.
much more um, interesting and kind of healthful drug than alcohol. And like, people need something. I mean, in a perfect world, we'd all go to the tofu and the yoga mat and go jogging, but we're not perfect. We're people, and we all are suffering and have pain, and many people need something. And like, cannabis is so much more of a healthy alternative than alcohol. But if you're the pharmaceutical industry and or the alcohol industry, and you make cannabis illegal, then all you have is alcohol. So by default, people drink. But now the cannabis is becoming less stigmatized and more legal. You're seeing a transition away from alcohol. So
Right.
Well, you definitely see those alcohol sales going down. I mean, across the board, whenever it happens, it's a big disruptor, this plant, and which is why the lobbying against its full legalization and expansion, I think, is obvious.
and
And
that's harm reduction right there.
Yeah.
Absolutely.
Yeah.
I mean, it's like it seems like alcohol is the first line for everybody because it's legal. You can get it at the corner store. You can get
Socially
as much as you want.
acceptable.
It's socially acceptable. You can get hammered on the weekend and go to work on Monday, and everybody's fine with that. Yeah, and it's the disruptor continues.
Yeah.
And we can talk a little bit about politics in a second, but go ahead.
The study, I've heard you talk about the study in Colorado about Medicare Part D.
Yeah, no, absolutely. I mean, that was really interesting when they legalized cannabis in Colorado. They studied the Medicare Part D prescriptions, which is prescriptions for people generally over age 65. And they went down across the board, not just for benzodiazepines or for opiates. They went down across the board. And it just makes you think that people, first of all, it said something about like patient empowerment. People are like treating themselves instead of having to go to the doctor. You could argue in some ways that could be dangerous if it's a concerning symptom like blood loss or something. But generally speaking, if they had a muscle spasm, they were probably just taking a puff instead of waiting to see the doctor, getting diagnosed, paying a copayment, going to the pharmacy and getting a muscle relaxant. If they had some erectile dysfunction, they'd take a puff. If they had a migraine, they'd take a puff instead of seeing the doctor, paying a copayment, getting some complex pharmaceutical like sumatriptan, and then taking a pharmaceutical. So people were like treating themselves for symptoms, and hopefully they're using common sense, and the symptoms weren't like, I haven't felt my toes in 6 months. Hopefully they were like symptoms that were like, discomforts that they were treating. But that was really remarkable. And it just goes to show how versatile cannabis is. It works on so many different systems in the body. It also makes it hard to study because if you give a patient with something like fibromyalgia, that chronic pain syndrome, cannabis, and they're feeling less pain, they're less bothered by their pain, they're less anxious, they're sleeping better, they're feeling a little happier, and they're going out and engaging in their activities. How do you study like one component when it's doing like 8 different things at once? So it does make it like a little bit challenging to study.
Right.
Speaking of studying, we've heard that you say that the endocannabinoid system is foundational. Does the Harvard Medical School, where you teach, does that incorporate the endocannabinoid system into their curriculum?
Well, I have to look into that, to be honest. Harvard is huge. And it's not like, we're all in one building and I could just walk over and say, hey guys, are you teaching the endocannabinoid system? I do teach medical students, but I mostly teach them about physicians and addiction. Right. Because I, for better or for worse, know more about that than most people. So that's what they wrote me in to teach the medical students about. But hopefully they do. It's only taught in about 13% of medical schools. And, they give a lot of lip service to it. When they do teach it, they don't necessarily teach it in a deep level. I would hope that Harvard would be teaching this, but I'm actually going to go look into that because it was such a good question. And again, Harvard's so big, I don't quite know where to begin, but it's hard to imagine that they wouldn't be teaching it. But that's true for every medical school. And at the majority of medical schools, they're either not teaching it or teaching it very cursorily just to kind of check off a box. And given that, tens of millions of patients are using medical cannabis, you'd think they'd want to study it. Not only that, but given how integrally involved in homeostasis and in sort of the micromanagement and feedback of all of the other, or many of the other systems the endocannabinoid system is. It's sort of a mystery. I mean, in one sense, it's not a mystery because it's sort of a holdover from the drug war. But, you know, doctors are supposed to be smarter than that and sort of think for themselves. And, you know, this is just a critical system to understand and also to exploit for drug development. So it's just astounding to me that doctors aren't like eating this up. I mean, it's just such incredible fodder for scientific discovery and for treatment. So we have a lot of work to do, but I could certainly find out if they're teaching at Harvard.
Yeah, that'd be great. Like, why isn't the endocannabinoid system and cannabis on the med school curriculum? Why? You know, gee, what could be the reason?
There are actually several reasons. One thing is changing the medical curriculum is like taking a huge boat and trying to change it. There's like a lot of momentum. Two is that the medical profession has brainwashed itself completely about cannabis. So there's a lot of like unlearning and relearning that needs to be done. Three, there's a lot of competition to get on the medical curriculum because there's like way too much to learn. If you've got to learn like 5 million things and you only have time to teach people 4,000 things, and this would take up like 200, it's a hard sell. You know, and it's sort of easy to just ignore it as like folk medicine. So, I mean,
or nutrition or food.
Yeah. I mean, there are like, you know, understandable reasons, some more legitimate than others, why they're having trouble incorporating it. I mean, there really is just too much to learn. And you know, now that's not a valid excuse, but it helps you understand it a little bit. There's so many breakthroughs every day. How could you? I could literally spend all my time reading about medicine and still not keep up. It's a real problem.
Well, yeah, I mean, on your Twitter, I mean, you're constantly putting out the new research. I mean, it just comes, it's constantly coming. Everything, the new, some of the new research is just remarkable.
Right. That's just on cannabis. I'm a primary care doctor. Imagine that for every single drug or body. I mean, literally, you need like 1,000 hours a day to keep track of all this stuff.
What kind of education do doctors in Massachusetts have to have in order to start recommending cannabis products?
Well,
any special education?
Yes, they need to get certified through the Cannabis Control Commission. They need to have like a medical license in good standing. And they need to, it's either 2 or 4 hours, I can't remember because it's different every state, of continuing medical education very specifically dedicated to medical cannabis. Now, this medical education is of varying quality. Some of it's too technical, like some of it's like about this receptor and that receptor, and that's not, like, not helpful at all. Some of it is about like, you know, you take one puff and your legs fall off. That's not helpful either. So it's hard to get the right, like, this is the endocannabinoid system. These are the basic receptors that you need to know. This is basically how it works. These are the main conditions that people are going to come to you about. This is how you start low and go slow, get people started. These are the main ways to consume it. And these are the main dangers and side effects. And here are the resources to learn more about all of these things. If more, they're really, I haven't seen anything like spectacularly good along those lines. But, you know, the piecemeal, you can get education, but it's, it just because it isn't coming from a institution. It's coming from, you know, people here and there that are trying to do it sort of privately.
Are you finding more doctors looking for the education? Are there more and more doctors seeking it out?
Absolutely. More and more doctors are contacting me to talk about it. More and more doctors are participating in these programs. The University of Vermont now has a program for University of Vermont School of Medicine has a program about that doctors can get a postgraduate degree in medical cannabis. I mean, I know it's not like a degree, like a certification in addiction medicine that gives you like any teeth, but like an educational degree. And a couple other places are starting to have these programs too, where you can go and get like a intensive certification. So it's definitely happening and it's accelerating, but it needs to be more uniform and more consistent. I think in 5 or 10 years, a lot of us are going to be very busy just like educating, because I think these things are going to be all over the place because everybody's going to have to know about this stuff.
Yeah. What did you learn in medical school about cannabis, and is the same information being taught?
Well, you know, I entered medical school knowing a lot about cannabis.
Yes, you did.
So and so it's a little bit hard to remember what I learned because I didn't really believe any of it.
Right.
But I remember it being like sort of a lot of drug war nonsense cloaked in medical terminology, and with an extreme emphasis on the harms and very little lip service to the benefit. They had a mention that it helps cancer patients with chemotherapy. They couldn't like ignore that completely. But that was pretty much what they dedicated to the benefits. And, there was such an emphasis on the harms. And I was in medical school in the 1990s. So, the younger people were, the more open to it they were. But there was just a lot of nonsense about it just whatever the dialogue was in the 1990s was pretty much what they taught us in medical school. There didn't seem to be very many people that were thinking for themselves about this issue. Like my dad did. I never understood why, if my dad could think for himself about this issue, why the other doctors couldn't, and why the whole almost the whole medical profession ended up on the wrong side of the war on drugs and ended up like promulgating these really like racist and destructive policies. Like, why couldn't they just say, this is wrong? We're criminalizing people for nothing. I still don't get it. I'm like trying to figure that out every day.
I mean, your dad looked at the same research that was available to everyone else and came to the same conclusions, despite NIDA and the NIH focusing most of their research on the harms. And only more recently are we starting to see research on the benefits of cannabis, especially now with CBD being vastly researched.
Yeah, well, it's complicated because like only the researchers that wanted to research the negative parts of cannabis would get funded. So it became self-selecting, and then only studies that looked into the harms would get funded. And then they sort of get, fit into the certain narrative that was getting spun. So it became sort of self-perpetuating, but still, I think like people could have seen beyond that. If some doctors could have, like, why couldn't the rest of them? Or why didn't they listen to the doctors that were seeing through it all? I mean, there were a lot of financial interests too, like the head of the American Society of Addiction Medicine, who was making millions on drug testing. And like, some of the pain doctors don't like it because they like to give injections and it threatens that. Or some of the addiction medicine doctors were having a field day treating cannabis addiction, which exists, but not in the extent. I mean, it's sort of over broadly diagnosed with cannabis use disorder. They rope in like most medical cannabis patients. It's absolutely ridiculous the way they define it with tolerance, withdrawal, and cravings. That's anybody who uses benzodiazepines, opiates, or SSRIs gets tolerance, withdrawal, and cravings. So 100% of people who use caffeine would have caffeine use disorder. Why pathologize a whole class of people that use substances?
This idea being in rehab for cannabis addiction is sort of like, it's a little low on the totem pole.
No, being in rehab is more destructive than using cannabis. I'm convinced. I've rehab for my opiate use disorder, and it was like the most brainless thing I've ever been to. I wrote about it in my book, and like just to criminalize people. I mean, my dad said that in his book in 1971. He said the real danger is criminalizing a whole generation of young people. That's more dangerous than the actual use of cannabis, and that's just as today. But the whole rehab industry is a huge, they fund these anti-marijuana groups. And, a lot of the referrals to rehab come from the courts. Like the kid goes in front of the judge, and the judge is like to the parents, do you want to go to juvie and have a criminal record, or do you want to go to treatment? They're like, oh, we'll go to treatment. Oh, it's cannabis addiction. We need a diagnosis so we could bill. And there's a huge financial incentive for prohibition. And so, part of it, that's part of the, who was it? Upton Sinclair that said something like, it's very hard to argue with a man when his earning a living depends on him understanding, or to convince a man understanding the opposite.
The opposite, right?
Yeah. That goes into like people who have been opposed to cannabis. But that said, we're winning the battle for hearts and minds, because people are seeing that, it is a lot more harmless than the alternatives, both medically and in terms of like recreational use. And even if it isn't, the alternative of criminalizing people is more harmful than the alternative of using this drug, even if this drug were more harmful, which it isn't. So on both levels, people are really waking up to the fact that it shouldn't be illegal.
Yeah, it is an exciting time for these developments, Hey, let's move on to talking about senior living facilities because it's a subject close to my heart. What would you say to persuade an assisted living facility or memory care in Massachusetts to adopt a medical cannabis program?
Well, it's interesting with memory care because one of the acute effects of cannabis is it can impair your memory, but at the same time, it could also cause. It just needs to be studied more because in Stacy Gruber's work, your cognitive function improved if you were a medical cannabis patient. So the story is much more nuanced and complicated.
Isn't it dose dependent?
They speculated, was it dose dependent? Was it age dependent? Was it dependent on lower THC and higher CBD? Was it because people were not in untreated chronic pain and not, up all night in agony? Was it because they were using less benzodiazepines and less opiates, less of the polypharmacy? There were a lot of plausible explanations for it. So I would bring that research and I would explain the clinical successes I've had. I would explain that not all cannabis use is the same. I'd explain that, their stereotype of like what cannabis use is. Some teenagers smoking like 5 joints is not really what it is. I'd explain that, if you use a small dose every day, you're much less impaired than if you use a large dose once a month. And I'd explain about CBD and THC and how you could use a high CBD to THC ratio. I'd explain the studies that show that it really helps people with behavior that have behavior difficulties in these settings. And I'd show research, I'd show these studies, and I'd expect them to be open-minded and to want to give it a try. The one complication would be if they receive federal funds, they might be a little bit nervous about it because the government just has this stranglehold on the funding, and until it's federally legalized, I would understand if they'd be nervous about that. Like a lot of hospitals are okay with their doctors certifying patients, but they really are uncomfortable if patients bring it in because they don't want to lose federal funding. So what I recommend is when patients bring it in, you just bring in like a nondescript gummy or something. You don't bring in your vaporizer and demand to show your right to use cannabis in the hospital and start vaping in the hallway. Why? What you do is you put the security guards who are probably on your side, and the last thing the security guards want to do is be taking away your medicine. But that's their job because someone's telling them to do that. And all you do when you do that, you don't make a point. You just put the security guards in a horrible situation. Just be subtle. I mean, until we have it legalized federally, let's have a don't ask, don't tell policy. And I think that could also work for like assisted living facilities. They could have the individual patients work with a cannabis savvy physician, and then they could just be low key about it. They don't have to be advertised if they're worried about federal funding that like, hey, look at this, we're all smoking pot. It could be like, just a low key thing, and it could really help the residents.
Yeah, for sure. For sure. We've read often that it helps with reducing polypharmacy. Is there a study about opioids and cannabis? When people start using cannabis, it helps them reduce their opioids by some like 80%.
Oh, yeah. Well, the 80% number is that they co-work on the same receptors, or the receptors co-work on the same pathways. So there's sort of like a 1 to 1 = 3 phenomenon. You give people like a small dose of opiates, which isn't enough to help with pain. And then you give people like a small dose of THC, which isn't enough to help their pain. But then you give them both of those and it helps their pain. They work synergistically. So it's been shown that you can lower people's doses of opiates up to like 80% by using medical cannabis. And that's really important because many of the troubles that you get into with opiates are dose related. The sedation, the confusion, the lethargy, the constipation in elderly people. I mean, most of my elderly patients are constipated anyways. And then you add an opiate, it's like a disaster. I mean, it sounds like a trivial thing, but it could be a real nightmare for these people. In fact, actually, did you know that's how Elvis died? He was so constipated from his heroin addiction that he was straining on the toilet, and he passed out. He syncopized, and that was it for Elvis. I mean, it's really a serious thing, opiate-induced constipation. Sorry for that detour.
No, you can totally die from constipation. I know.
No, but it's miserable. It makes people absolutely miserable. And then, in the New England Journal of Medicine, I tweeted this. No, it was in JAMA, the Journal of the American Medical Association, which just ironically is like the most anti-cannabis magazine in the world, because the American Medical Association is like totally like pro big pharma. But they have advertisements. I haven't seen them since I tweeted about it, actually. But they have advertisements for medications for opiate-induced constipation. So I'm like, okay, let's give people opiates, make them so constipated that they need another big pharma medication for opiate-induced constipation. Why don't we just use cannabis?
Cannabis and a little coconut oil, and you're good to go.
Right, exactly. But it's like, why do you need a medication and then another medication to treat the first? And now we're going to need a third medication to treat whatever the opiate-induced constipation causes. And it's just an infinite regress that enriches the pharmaceutical companies. It's absolutely ridiculous.
This is the plan. This is the plan.
Do you know of any private facilities in Massachusetts that might already be using cannabis at their place? You don't have to name them, of course, but do you know if anybody's doing it?
I could say the facility where my dad was living until he passed away this summer was, you could navigate to it by closing your eyes and sticking your head out the window and sniffing, because there was such a mushroom cloud of cannabis smoke over it. You could start about 10 miles away. You could just start sniffing out the window. And that's how you could navigate when you're trying to drive to visit to him. So,
okay.
Now, that wasn't just your dad. That was other people there as well.
There were other people, anybody that my dad came into contact with.
Did he use, this is a little side thing too, did he use, other than smoked cannabis, did he use tinctures? Did he use topicals? Did he use it in every possible way?
Well, yeah, in the end, he was very sick with 3 different cancers, and I threw like every cannabinoid at him, and I think it really helped him. And, I say CBG and CBD, and I was really trying to slow down some of the cancers. We don't have definitive evidence that this works, but at the end, I was like, why not? Well, it's not going to harm him.
Right.
But he mostly liked to smoke. He was very affable vape, because it's safer. But he's a very affable person. He just was always never happier when he just like had people around him smoking and chatting. He's very sociable.
Yeah. Very nice. Hey, speaking of harms, what might be some of the potential harms of a low dose full spectrum cannabis for seniors and people living with dementia? Low dose CBD and THC.
Well, first of all, with CBD, there are medication interactions.
Yes.
Exactly the same way that grapefruit juice works.
Right.
So it competitively inhibits the enzymes. The CBD uses up the enzymes, so the medication can have a higher level in your blood because the enzymes are busy metabolizing the CBD. So for a lot of medications, it doesn't really matter. Like, we make an educated guess to give you 20 milligrams of something. If you have 20.5 milligrams, big deal. But for some medications, we actually have to keep them within a narrow therapeutic range or therapeutic window. So, for example, if you're on a blood thinner, you should tell your doctor that you're started on CBD. Now, I haven't ever heard of anybody bleeding to death from taking CBD, but the fact is it can affect the levels of your blood thinners, or say an anti-seizure medication or an immunosuppressant, just medications that have to be in a narrow therapeutic window. With low doses, you avoid a lot of the other side effects. Someone uses a high dose of cannabis, they need higher doses of anesthesia, which is why it's such critical that doctors drop the attitude and that patients feel more comfortable communicating with their doctors. But with low doses, that wouldn't be as much the case. You also could have with CBD liver enzyme abnormalities, but with low doses, that probably wouldn't be the case. Now, with any THC, you could have confusion, delirium, worsening memory, falls, ataxia, all these things that really, any drug that has a psychoactive effect, if you have a 80 or 90-year-old brain, you're more susceptible to it, not to mention 80 or 90-year-old kidneys and liver. And if you're doing that on top of already having mild, moderate to severe dementia, you're going to be particularly susceptible. So you would obviously want to monitor and track the mental status very carefully. And then the final thing I'll say is that one thing cannabis can do if you're not really careful with the dose. I've never had a problem with this because I like browbeat my patients to like start low and go slow.
Yes, you got to.
If people like, get overzealous, all their friends are using cannabis, they're excited to try it. They go to a dispensary. Wow, that brownie looks good. And they don't take a low dose. They take a bigger dose. They can get anxious and then they can get a tachycardia. They can get a rapid heartbeat and that could precipitate cardiac problems. So again, all the mischief you can get in with cannabis is dose related or virtually all of it. And this could all be mitigated with like proper oversight and education. But some of these places are like card mills. They just give you a certification card. They don't give you much education. When I certify, I don't farm my certifications out to anybody. I do it myself and I just like talk to people personally. So I know that they get the message, but you can have all kinds of problems if you miss, and you have to be careful too with the edibles. Like if they're a chocolate bar and then, if someone has dementia and you say, okay, just take one of these squares and then they're just going to see
the whole bar is
like
going. Yeah.
Kid. I mean, I'm a little dubious about making cannabis into tasty treats just because you don't want pets or particularly little kids. I mean, if you're a 4-year-old, your job is to eat the whole bag of gummies. That's like what you're supposed to do. So I'm not a big fan of making them into like, things that like
who eats a quarter of a cookie?
Nobody.
I mean, come on.
Well, actually, I was touring a dispensary in Maine and they had these sodas that were 100 milligrams. Who drinks half a soda?
Right.
Like it goes flat. Like nobody drinks half a soda. And the THC was in small writing, and it's like you drink half and put it in the fridge. 100 milligrams.
Yeah.
I mean, most
That's
people,
not gonna work out.
like a veteran with a traumatic brain injury who takes 300 milligrams at night, that's a huge dose. That's not a medicinal dose. And I just couldn't believe that was in like a soda. So we have to either regulate the industry or the industry has to show enough sense to regulate itself. These are self-inflicted injuries that the cannabis movement is inflicting on itself by having people go to the emergency room because people overdose on these sweets. There's no reason for it. And an elderly person, just like a little kid, might not remember. And then there's a chocolate bar. They might not even know to read the warning. I mean, we have to be sensible about this stuff.
Now, what do you think about the new standard that's just been achieved by NIDA with asking about the 5 milligram, or now setting into stone, I guess, the 5 milligram dose as the dose to be studied?
Well, NIDA and cannabis don't mix well together because they can to deceive, dissemble, suppress, mislead about cannabis. So, I'd love it if NIDA and the DEA just like were never involved with cannabis at all. If they said, we're sorry, we screwed this up and we're going to take a vow of silence, and they just disappeared. So, but it's probably more of a good thing than a bad thing to come up with a unit of measurement. It's a little bit complicated because it's very different if you eat it than if you smoke it.
Right.
And also they're different strains or cumivars, and that's of THC, which is one of 600 different molecules in cannabis. But I would say it's more of a good thing than a bad thing, because part of the thing that plagues these different studies is that they're all different preparations and there's no standardization. So anything that, and they are changing their tune a little bit. I mean, they think NIDA is trying to come a little bit out of the Stone Ages and into like at least the Middle Ages.
I think they're growing better cannabis now.
Hopefully. So I think it's more of a good thing than a bad thing.
And you grew up in, one would say, a unique family as part of the cannabis legalization movement and medical. I mean, your life is the extremes of every part of cannabis. I mean, to the extreme of the legalization movement, to the extreme of youth exposure, to dealing with a drug addiction later. I mean, I would almost, reading your story, I would almost put you in the category of being someone that would be a prohibitionist, that might think that cannabis may, lead down a path that might lead you somewhere else. But I guess that's your exposure to your dad and his research and the people around you that.
And your brother.
Your brother allowed you to balance all of that information and to come out on top saying, hey, it's got problems, there are harms associated with it, but overall, this is a healing plant.
Yeah, the cannabis helped. That's sort of a long and complicated conversation, but the cannabis helped my brother. The cannabis has helped me a lot at different stages in my life. The cannabis helped me actually get off the opiates. It really helped me with the withdrawal symptoms. And it's just been very helpful for me for migraines. It helped me with my writing. It helped me a lot in really with my writing. It helped me with some interpersonal connections. It helped me with creativity. I mean, there are a lot of ways in which it's helped me. And I just think that the reason people demonize cannabis is sort of predicated on a lot of misinformation they've been fed. The government feeds it to the doctors who feed it to people, but none of it's true, or very little of it's true. And we need to like rethink this issue from scratch, because a lot of the stuff that's in the literature, part of it's true, but it's not wholly true because it was not really science, because it was intended to find harm. And science is we don't know what we're going to find, if it's harmful or beneficial. So I think we really need to reevaluate like the whole entire literature around cannabis. I just remember reading my father's book, Marijuana Reconsidered, when I was a teenager, and he demonstrated like surgically that what was written in Playboy, which actually had really good journalism, what in 1968 was more about cannabis, was much more accurate than what was written in the Journal of the American Medical Association. And that really got me thinking, like, what's in the record and how can we rectify this? So we just have to sort of think for ourselves about cannabis. And again, cannabis and addiction is a really, really complicated matter. And ironically, I don't think many of the addiction people quite understand it, because a lot of them haven't really tried cannabis. And, I read one book by this cannabis specialist about marijuana, and you could have literally replaced the word heroin for cannabis, and the book would have read perfectly well. And I'm like, how are you possibly a specialist in cannabis? This person clearly hasn't been ever within 10 feet of a burning joint, ever. And not like lived experience. You have to have lived experience for every single thing. You don't need a lived experience with like being bitten by a tarantula to write about, poisonous tarantulas. But in this particular thing, it seems very relevant. And I feel like I've been exposed to it like from every possible angle.
Right.
Not that I'd recommend getting addicted as part of the curriculum. That's like a lot of but it actually, like, I just think I feel like I understand it. And like, people do get very dependent on cannabis, but it's a different type of addiction. No one's robbing pharmacies. And, it's very complex. And I just think that there's been so much propaganda and rhetoric. It's just hard for the doctors literally have to like relearn everything they've been taught about it if they want to think straight about it. And again, some doctors like Andy Weil, Norman Zinberg, my dad, Sanjay Gupta, was able to do it, but and a lot of them aren't against it. But a lot of the ones who are the prohibitionists are like, a lot of the stuff they're saying is just like so flat out. To me, it just seems so flat out untrue. And they even seem like unaware of like why it's untrue, because they just don't have the social lived experience or political context to understand why it's untrue. So it's, it's a marathon, not a sprint. But it's sort of like trying to talk to people that don't speak the language. That makes sense at all?
Yeah,
Yep, totally.
absolutely. Like 100% sense. Babe, do you want to keep going?
Oh yeah, well, talking about prohibition, other substances on the Schedule 1, we're seeing a renaissance, if you will, of psychedelics moving at, I would say, even a faster pace now than cannabis ever did, due to some recent breakthrough studies and being put on the breakthrough list for the FDA for psilocybin, the MDMA information that's coming out recently. Now, you've also had your experience with psychedelics. And what are your feelings on this new push and the science behind finding mental health relief in psychedelics?
Well, I'm a huge supporter. I mean, ironically, my dad's so well known for his work on cannabis, but he wrote 2 spectacular books on psychedelics. And when I was 13 in 1979, he wrote a book called Psychedelic Drugs Reconsidered,
Mm-hmm.
urging that psychedelics be taken out of the streets and put into the lab and tested for psychiatric purposes. In 1979, literally like 40 years ago. My dad was so prescient. He was so ahead of his time.
He really was.
I read that when I was 13. So starting at age 13, I've been a huge advocate of using psychedelics for psychiatric purposes because I read my dad's book. So I've been a huge advocate of this since literally for the last 40 years. It's really encouraging me that it's happening and that it's being studied and being adopted. It's really interesting to me that the doctors are open to this and they're closed to cannabis. I don't understand why they're closed to a drug where you take a puff or two and you feel mildly euphoric and you can still talk to people and engage. Like they're open to a drug where like you take a hit and like you're tripping for 8 hours. And like, it sort of mystifies me. I don't understand if it's because there are more concrete studies or if it's more like you still need the doctor be in charge, or if it's like there's a big pharma connection, or if cannabis paved the way for them to be open to psychedelics. I'm just not sure, but it just sort of mystifies to me how these like same doctors can be like, oh, cannabis is dangerous, it's psychoactive. And then they're like, sure, let's give everybody psilocybin. It just mystifies me completely. If either of you guys have an answer to that, please let me know. But
it's a dichotomy for sure. I don't understand it completely, other than maybe it has something to do with pharma, the molecule. I mean, they're not talking about you growing mushrooms in your closet. They're talking about psilocin, the molecule, and very regulated. I think that's the way it's going to end up. I think Canada is a little more open to it. You can buy mushrooms now, just like you could buy pot before in Canada. So I don't know how far that's going to go as far as, traditional medicines being authorized. I'm hoping that in the laws that come through, that is, that's considered because many of these shamanistic practices with psychedelics are, they have their place as well, I think. So hopefully, it's encouraging.
I get to hear stories from my mom about like my dad and Carl Sagan visiting Terence McKenna on his island and stuff like that. I missed out on all the fun because I was too young. I'm so encouraged that this is happening, and I would be love to be involved in it. I'm just a little busy with the cannabis stuff. Sure. But once we get cannabis legalized, I'd love to do the psychedelic stuff.
And do you think that's going to happen relatively soon? How are you? What's your outlook?
Well, it's not like we're just going to legalize it. There's still going to be a lot of equity issues and a ton of education and a ton of people still sitting in prison. So it's not like it's going to be like a illegal legal. But in terms of federal legalization, there's nothing really stopping it now, except the fact that Biden seems pretty much against it. He just doesn't understand it at all. Like completely doesn't get the issue. Theoretically, if we get another Democrat after Biden, maybe then. So maybe in 5 years, 3 to 5 years, if we get another Democrat. If we get a Republican, we're sunk. And Biden, I don't think we're going to make any progress. But I think we're going to make progress with like safe banking and more. At some point, it's going to be like 48 states are going to have legal cannabis. And it's just going to start to look pretty ridiculous that we don't have federal legalization. And at some point, I think the federal legalization is just going to tip over, regardless of who's in control, because it's just going to be so. Mexico will be legal. Right. Canada will be legal. Half of Europe will be legal. All the
rooms in every city in most of the states full of cash of IRS taxes collections. Yeah.
So at some point the dam's going to break, but I would say like if we got another Democrat after Biden, assuming he's one term, then it would get legalized, would be my best scenario.
Yeah, I wish folks like you could have an audience with him to talk to him about your dad's research and what you found in your practice and throughout your life. And people like Alexis Bortel and Riley Maidler and other people who are really experiencing this plant. Maybe he could be swayed.
I would love to. I wonder if he's if he'd be mentally nimble enough to sort of challenge his preconceptions and his view. So someone like Sanjay Gupta is, I wonder if Joe Biden is. I mean,
Yeah.
I'd really respect him if he could.
Well, Cory Booker seems to think he's on board. He understands that decriminalization is actually descheduling, but I don't know if I agree with that, because
I love Cory Booker.
well, we'll see what Schumer and the gang come up with. They seem to be pushing hard. Maybe that's because they know Biden's not going to support it. I don't know. But they do seem to be making more moves in the Senate. 2 Republicans just introduced a new bill today to deschedule and, protect vets and interstate trade. Oregon loves that idea.
Yeah, but do nothing about social justice issues?
Yeah,
That's
no
not
social
okay.
justice.
Well, that's the problem, is that, how do you put this? More people are interested in legalizing than are interested in legalizing plus social justice.
Yeah.
And if it were just legalization, like, everybody would go for it.
Right.
Just a clean descheduling, I think they'd get much more support.
Right, exactly. But then the social justice people feel like their only chance is to couple the two.
Right. And that's what
I
Schumer's
kind of
saying.
agree with them.
No, I agree with them too. I mean, you could really argue it both ways. I have friends that would kill me for arguing it this way, but you could argue, like, you don't want to put anybody else in prison. So, like, the sooner you legalize, the better. But the fact is, no one's ever going to go back and deal with social justice unless you do them together. So I mostly agree with that.
Yeah. Hey, I'd love to ask you about a few of your patients. Would you be willing to share about a few of your senior patients, or if you have any patients living with dementia you could tell us about?
Some of them don't like the feeling and stop. Most of them find it beneficial for whatever we're treating, usually chronic pain or insomnia, and enjoy it and find it helpful. And some of them say that it helps them kind of get out of their misery and focus on other people and other things. And that it's really helpful not just to treat their symptoms, but that they weren't expecting it, but it's also helping them, like, engage with other people and in activities. So I find that really interesting. And I think part of that's that they're not in pain or they're sleeping. And I think part of it's just the sort of the effect of cannabis that is, like, sort of pro-social. Which is why people are studying it for autism and stuff. And that's pretty important, given that our society, and particularly elderly, are suffering from, like, this epidemic of loneliness and isolation. And if, cannabis can help people with that, wow, that's really gigantic.
Yeah.
And COVID hasn't helped with that this last year, that's for sure.
Oh my God, it's awful. Some of these people that are living by themselves, it's just been miserable. Literally, people make doctor's appointments just to have some contact.
Right.
And it's like, that's really depressing. And then, like, you're busy in the office, but you don't want to end the visit because, like, you're the only social contact they have. But in time, you got, like, all these, you're getting paged, like, this is angry horde waiting for you to, like, do that. You're behind for the next patient, and they're, like, saying, I'm going to leave if Dr. Grinspoon doesn't get in here in the next 5 minutes. And it's really stressful, but people are, like, so lonely. It's awful. But so I would say that people in general do really well. And in my experience with patients who are challenged with their memory, it hasn't really been an issue with the memory, because their memory is already pretty gone. It hasn't really made it worse, and they already need supervision. And the reports from the caretakers are that it just makes them sort of, like, happier and more relaxed, and, like, a lot easier to deal with, because they're just more content and engaged in things. And if anything, it makes them sort of more animated, talking about their earlier life and their earlier experience, which they can remember and have access to. So I would say, like, it doesn't, just like I started the show saying, it doesn't work for everybody, but it works for many people. And for the people that it does work for, it really improves not only the specific symptoms that you're targeting, but again, because it does so many different things at once, it can really improve sort of their quality of life kind of globally.
Nice. And you mentioned start low and go slow. I imagine that you're using very low doses with your senior patients.
Yeah, with my senior patients, it depends a little bit on 2 scenarios. One is, we were in the 60s hippies and we smoked all the time. We enjoyed it. Now I want to try it again. Then you're much more comfortable being like, all right, go to the dispensary, get the smallest gummy bear and take a quarter of it, then the next day take a half, ramping up a little more quickly. You start really, really low. If they've never had any experience ever, then I just start with CBD. I'll start with a low dose of CBD, slowly ramp up the CBD. Then usually sometimes that helps, but usually you need some THC. And then I'll add literally a milligram, a teeny, a puff is 5 to 10 milligrams. I'll add a milligram, and then I'll slowly taper it up. Or I might start with a tincture, either a 1-to-1 CBD THC tincture or a 4-to-1 CBD THC tincture, and just start with a drop, saying this was not going to do anything, but just for the sake of starting really slow, and then the next night 2 drops, and then over a couple of weeks, so slowly get up to a level which is starting to have some impact. And I just say to them, if you're going to make a mistake with the dose, the mistake we're going to make is that we didn't take enough and it didn't do anything.
Right.
We want to avoid the mistake of taking too much, because that's going to be really uncomfortable, and it's going to turn you off to this whole process. So, just take your time. Even if it takes us a month to titrate up to the right dose, that's the best way to do it, because you don't want to take too much. You're going to be really uncomfortable, and then eventually get there, and then they're usually really happy with it.
Do you have a nice wide variety of ratioed products and things available in Massachusetts? Is it pretty
Wide open?
Not as much as California. California, they have a million things, and here we have, we have dispensaries will have 4 different types of tincture in different ratios, and they'll have 6 different types of flour, and then they'll have a couple of drinks. Then they'll have a bunch of different chocolates and candies and stuff that, are just waiting for some little kid to.
Yeah, that's not medicine.
Right.
And then they'll have some topicals, and then they'll have the vape pens and stuff so there's some variety. There isn't huge variety like there is in the West Coast, because we just haven't had as much time. It's only been illegal. The stores have only been open for 4 or 5 years.
Sure. And I don't suppose that medical cannabis is covered on any insurance in Massachusetts, is it?
Unfortunately, it's not. Some of the dispensaries pitch in, and they help veterans. They give them discounts, and they and there's some groups that help veterans, because veterans have a really hard time affording it. But I've had patients that have really successfully gotten off opiates and or benzos, and they've come back to me a couple months later and said I was doing great on the cannabis, but with my Mass Health, state subsidized insurance, my Percocet was $1 a month, and the medical cannabis is $100 a month. So I just had to go back. I can't afford it. So, the affordability is really an equity issue. Medical cannabis can't just be for rich people. I work as a primary care doctor in an inner city clinic, and my patients range, but a lot of them are quite impoverished, and they just don't have the means to. They got rid of the fee to get the card, so I can get them a card. But if you can't afford the product, it's just not very helpful at all.
And then there's taxes on top of it, where no other medicine is taxed.
Actually, with our card in Massachusetts, no taxes.
Oh, that's good. No taxes at all?
But it's still really expensive. A gram in Maine costs $35.
Oh, wow.
$55 to $60 in Massachusetts. It's really expensive here, but no taxes. But so if someone, gets this Social Security for $800 a month, how are they going to buy medical cannabis? It's absolutely impossible. We got so creamed during the COVID crisis in my particular neighborhood, where my health center is in Chelsea. We had the highest rate in the country for a week or two, because people are so poor. They're all living in the same apartment. Nobody has cars. Nobody can take 2 weeks off to social distance. You don't work, you don't eat. It's really poor. So how are people going to afford medical cannabis?
Right.
In Canada, they give it to their veterans. They give them a certain quantity every month. They're so much more advanced than we are. So, and the pharmaceutical companies are really enjoying the fact that Medicare prescriptions dropped across the board. They're making money off of this. So why can't they subsidize some of the cannabis? Is absolutely ridiculous. They will.
Yeah.
They're just hiding behind the federal illegality, but the minute that goes, they're going to have to pay up.
That's where I think a clean deschedule would even, open up many more, avenues for that, for people to be able to pay for the medicine. If nothing else, that's a social justice issue, like for the veterans, because they can't afford it. If you just deschedule it, I think that's going to open up a number of things. But yeah, it's a shame that that's great. You don't get taxed. They make it very difficult to get a card in California. It's basically useless.
You still have to pay 15% tax, even with
No
a
matter
state
what.
issued card.
Right.
Yeah.
Really?
Yeah. And you have to pay $100 to get the card.
Yeah.
Really?
Uh-huh.
Wow.
If you're on Medi-Cal, you get discounts, but you still got to pay the 15% tax.
Now, where did they just, the courts said that workers' comp, is it
In New
Ohio?
Jersey.
New Jersey.
New Jersey.
New Jersey. Workers' comp has got to pay his monthly cannabis bill. So, hey, we're making progress there.
I like that. And workers'
I like
comp
it.
never pays for anything. I mean,
Yeah.
when you have a patient with workers' comp, like you order an MRI, they're like, we're not going to get that. You order, physical therapy, they're like, we're not going to pay for that. They never pay for
Please.
anything, but they pay for the medical cannabis. I just thought that was so funny. Like it's in my experience as a primary care doctor, like trying to get workers' comp to pay for anything is impossible.
Well, listen, they
forced.
didn't want to do it. It was the judge that told them they had to, so they were fighting it all the way. But
I just think it's funny that was what they finally paid for.
Right. Wow, this has been great. This has been awesome.
Dr. Grinspoon, is there anything you wanted to add that we haven't talked about that we could put in the episode?
We covered a lot of stuff.
Yeah, we did.
What are you most excited about right now? What's on the horizon for, what's on the top of your radar for research, or how cannabis medicine is moving forward in any aspect?
Well, I'm excited that the wave of legalization is moving around the world. I'm excited for a lot of great education, getting doctors up to speed. And I'm really excited, even though I'm not a primary researcher, I'm more of a clinician educator type person. I'm just really excited for all this incredible research that's being done. And we're really finally starting to understand more about the endocannabinoid system. And there's so much potential in terms of like drug development. I mean, it's absolutely amazing with these minor cannabinoids and the receptors, and we're learning how to exploit them, and we're just starting to like sketch them out. So it couldn't be a more exciting time to be involved in this issue. And I just feel very fortunate to be involved in it in, so many different ways. It's just really fun to view it historically. I've been involved with it for the last 56 years, and I'm only 55 years old. I joke that I was involved in utero. And then to be involved as a medical doctor, to be involved as someone who's been involved in like the movement, it's so much fun. And it's such an exciting time between the science and the political progress that we're making.
Absolutely.
Fantastic. Well, they're growing cannabinoids in yeast now, so it's a brave new world.
Yeah, indeed.
My oldest friend is an Alzheimer's specialist, and he's very skeptical.
Oh,
So
really?
I'm working on him.
Very good. Well, definitely send the podcast his way, because, it's just expert after expert after expert, such as yourself, talking about how it can really help. And then the people living with dementia that we get to interview tell us themselves.
No, I know. Believe me, I've spent like days talking about him with it, like literally. So, and we're in a book group together, and I've helped edit like 4 of his books on dementia.
Yeah.
And I know all about like his thinking, and and I've been friends with him since like grade school. So I'm working.
Would he be willing to think about CBD because it's non-intoxicating, or maybe the acids?
Thinking about CBD. He started to recommend CBD. Yes, so we made it.
Little victories, small victories.
That took 10 years, but he's not on the THC yet.
Well,
So-
maybe THCA.
Well,
The acids.
suggestion.
Yeah.
It's a challenge. It's a challenge.
Unfortunately, he works at the VA hospital, so I can't get him high to talk to him about it. Not that a doctor would ever get high.
Never, never.
I can't get him high to talk to him about it. I bet I can convince him if we were on with a few cannabinoids. So
Yeah. Well, maybe give him some CBD, because CBD helps with neuroplasticity also.
no, I know, but it wouldn't give him like the major insight he had
Right.
a puff or two with. So
Dose
You're
them.
right.
we're working on it. Next time I talk to you guys, hopefully I'll have a more victory to report.
Sure.
Awesome.
I just spoke to the American Cannabis Nurses Association about cannabis use in the elderly last week.
Yes.
All
We
that stuff was in my head. So, but it's
Oh.
a great topic. I mean, it's really helping people.
Dr. Grinspoon, how can people reach you? How can they get you as a coach?
Oh, petergrinspoon.com.
Perfect.
Yeah, no, I love health coaching, and I love coaching people about cannabis. It's really fun.
Excellent. Cool. Well, Dr. Grinspoon, thank you so much for being with us today. It's been really delightful and educational having you. Really.
Absolute pleasure. Nice meeting you guys. One
Awesome.
Very good.
Awesome.
Hey, anytime you want to come by and chat, please just reach out. Let us know.
Oh yeah,
and
definitely.
We'll be reaching out to you again, I'm sure.
And following you all the time on Twitter and just your information. It's great. Thank you so much. Dr.
Well, nice to meet you guys.
Nice
Thank
meeting you
you.
as well. We'll
All
talk
right,
again.
have a good day.
Thank you.
Okay.
Bye-bye.
Thanks for joining us for Cannabis Helps Dementia. Be sure to download, rate, and review us on iTunes or your favorite podcasting network.
And please share this podcast with anyone you know in relationship with dementia.
Do you want to tell your story of how cannabis helps dementia? Leave us a voice message at anchor.fm/cannabishelpsdementia. Or you can drop us a note or connect with us on the socials.
Check out the Society of Cannabis Clinicians website to find real medical professionals familiar with cannabis medicine in your area or online.
Because you remember, we're not doctors, just family caregivers turned advocates.
And don't forget, download, like, and share what you learned. Cannabis helps dementia.
Why don't you get wise? Get up and get out. Get rid of that frown that's been dragging you down and get up in the air. Just pretend that you can fly. You'll never know if you can.